Hi, my name is Melina Munoz, and today I will be presenting a case study applying the Generalized Anxiety Disorder Item Screening Tool, commonly known as the GAD-7. This presentation will demonstrate how the screening tool is administered, how results are interpreted, and how the findings guide evidence-based management and referrals for adolescents experiencing anxiety symptoms. The GAD-7 is a brief standardized screening tool used to identify symptoms of generalized anxiety disorder. It consists of 7 questions that assess how frequently anxiety symptoms have occurred during the previous 2 weeks. Although originally developed for adults, it has been validated in adolescents and is widely used in pediatric primary care and mental health settings. The tool helps clinicians determine the severity of anxiety symptoms and whether further evaluation or intervention may be necessary. The GAD-7 includes 7 questions related to common symptoms of anxiety, such as excessive worry, restlessness, irritability, and sleep disturbances. Patients rate how often they have experienced each symptom over the past 2 weeks. Each question is scored from 0 to 3. The total score is obtained by summing all responses, given a possible score range from 0 to 21. The screening typically takes only 1 to 2 minutes to complete, making it practical for use during routine pediatric visits. This patient is a 13-year-old adolescent presenting with frequent worries related to school performance and academic expectations. The patient also reports difficulty falling asleep due to persistent thoughts and concerns. These symptoms raise concern for possible anxiety. Because anxiety disorders commonly emerge during adolescence, a standardized screening tool such as the GAD-7 can help quantify the severity of symptoms and guide further evaluation. Based on the patient's symptoms in the case scenario, the GAD-7 responses may appear as follows. The adolescent reports frequent worry and difficulty relaxing, with several anxiety symptoms occurring most days of the week. When scored, the responses produce a total score of 14. A total score of 14 falls within the moderate anxiety category. Moderate anxiety suggests clinically significant symptoms that may interfere with daily functioning, particularly in areas such as school performance, sleep, and social interactions. At this level, further evaluation and treatment are generally recommended. For adolescents with moderate anxiety symptoms, non-pharmacologic interventions are typically the first-line approach. Cognitive behavioral therapy is considered the most effective evidence-based treatment for pediatric anxiety disorders. CBT helps adolescents identify and challenge anxious thoughts while developing healthier coping strategies. Additional supportive interventions include improving sleep hygiene, practicing relaxation and mindfulness techniques, and encouraging open family communication. Depending on symptom severity and functional impairment, referral to a pediatric mental health professional may be appropriate. A psychologist or licensed therapist can provide structured cognitive behavior therapy. Collaboration with school counselors can also support the adolescent in managing academic stress. Referral to a child and adolescent psychiatrist may be necessary if symptoms are severe, persistent, or do not improve with therapy alone. Pediatric nurse practitioners play a critical role in identifying mental health concerns early. Using validated screening tools such as the GAD-7 allows providers to objectively assess symptoms and initiate appropriate interventions. Equally important is educating families about anxiety disorders, supporting adolescents in accessing mental health resources, and coordinating multidisciplinary care. In conclusion, the GAD-7 is a brief and effective screening tool that can help pediatric providers identify anxiety symptoms in adolescents. In this case, the patient's score fell within the moderate anxiety range, suggesting clinically meaningful symptoms that may impact sleep, academic performance, and overall well-being. Early screening allows providers to implement appropriate interventions, including cognitive behavioral therapy, stress management strategies, and education for both the patient and family. When necessary, referral to mental health specialists can provide additional support and treatment. Pediatric nurse practitioners play a critical role in recognizing mental health concerns early, applying validated screening tools, and coordinating care to ensure adolescents receive the support they need to manage anxiety and maintain healthy development.